Good day, dear students. In current lecture, we will discuss viruses which can cause neural disorders and damage neural system. We will talk only about few which are important in our countries, in both India and Russia. So first virus in that group and the major pathogen, it is a rabies virus. Of course, it is one of the most famous viruses worldwide. It belongs to family of Rabies, negative sense single-stranded RNA containing viruses. And actually we have more than 100 viruses which can infect a wide variety of hosts, and some of them are plant pathogens, some of them are invertebrates pathogens, and a few of them, five other and one rabies virus itself can be dangerous for human and highest animals. So as you know, and you should already know, that rabies virus infection is dangerous because it can cause acute damage of central neural system and actually can lead to fatal outcomes. And if any symptom of rabies appear, disease is always lethal, and curage of the disease is not possible after onset of clinical symptoms. So common data, worldwide data, shows that actually more than 99% of all cases are caused by bites of dogs. And of course, we have the major area where rabies prevail is in Asia, because a lot of dogs are used for food here in that country. And of course, no one cares about the health of those animals. No one think that it is some domestic pet or something like that. And we have Africa, where we have wild dogs, such as a dingo dog or other dogs. And of course, again, it's difficult and not possible to control health of those animals. So almost half of people ill with rabies are kids of young age, up to 14 years of age, because they cannot actually recognize that animal is rabid or not, and they're always trying to play with dogs. And of course, they do not understand danger of that animal, and that's why they're in the main group of risk to be ill with the rabies. So structure of virus is very unique, and mainly it is described as a bullet-shaped virus. It's really looking like a bullet. It is made of 5 main proteins. It is a glycoprotein spikes or peplomers, which are covering the whole surface of virus, and actually about 400 of peplomers identified in the structure of rabies virus. It is a matrix protein or M protein, which is made of capsid proteins, and it is a coverage of genetic material. We have phosphoprotein and nucleoprotein. It is a proteins which are located within a viral particle. And we have that enzyme polymerase, which is known as an L protein, and again, making that viral structure. And of course, the major antigenic protein, it is a glycoprotein, because it is the superficial protein, and other proteins as well can be used in diagnosis or identification of the virus. If you talk about animals, again, mainly it is dog or dog-type animals in our territory, in the area of Russia. It is mainly fox. They are acting as the reservoir of infection. They can bring it to villages and transmit to dogs, domestic dogs, or to people who are living here in rural areas. It is dogs which are not vaccinated, and usually the virus is transmitted through saliva and bites of animals. So virus itself is not highly contagious, and intact skin is a good barrier for that virus. It cannot penetrate, but usually if it is a aggressive animal, then bite will make an entry gate for the virus, or if it is some domestic animal, it can just lick some area of the skin which is already damaged, some scratches or other injuries, and through saliva that virus can get into host. So how to recognize that animal is ready? First of all, it is hypersalivation, a lot of saliva produced by that animal, and actually that saliva is looking like a foam or produced as a foam. So animals usually have abnormal behavior. And if you talk about domestic animals, which are usually polite and kind and calm, so in that case, they will become aggressive and they can bite owner. They will be not friendly with surrounding people, which is not normal for domestic dog. And if you talk about wild animals, they will have abnormal behavior. And if usually normal behavior for the animal is to be afraid of human and to be scared by of human. So rabid animals usually will try to get closer to human. Normal animal will run away if human will be in area of visual contact, and a rabid animal, wild animal, will try to come closer to you, to uh, play with you, to let you touch him. And usually during some close contacts, again, kids, they will not understand that it is something wrong with the animal. That animal can bite. Of course, they will try to play with domestic animals or with some other pets, and they can bite them during playing, and domestic animal will transmit disease to a host. So incubation period vary from 30 to 90 days. So usually it is about month and a half. So minimal duration is 5 days, and actually maximum duration of incubation period described and documented in medical literature is more than 2 years. So we have several factors which can impact that duration. First of all, it is place of bite. If it is neck, so virus will have very short way to get to brains of the victim, and incubation period will be short. If it is a leg, then of course virus will need to pass much longer way, and incubation period can be longer. And one more thing is height of the subject. If subject is very tall, then incubation period will be longer. And of course, depth of the wound can again have a major significance, because if it is superficial wound and a lot of adipose tissue is around, virus will not invade into neural tissue immediately. First, it will hide in some underlying tissues, multiply locally only. Then, when amount of virus will be increased, it will invade deeper and find some neural axon or some other neural tissue. And in that case, incubation period will be longer. If the wound is deep, it can affect directly neural tissue, and virus will invade into neural system immediately. So if incubation period is over and clinical presentations will appear, usually we have a prodrome stage. It's about a week when common symptoms of some flu-like disorder will appear. Any, it is possible to have, and usually we have several symptoms which are unique for rabies and should tell to the doctor or surrounding people that something is wrong. It is photophobia, afraidness of light, and some problems with sleeping, inability to sleep, nightmares, depression, and abnormal behavior, loss of appetite with anorexia. Usually it is already some pre-symptom of future neurological disorder. After that stage, acute neurological period will change that prodrome period, and subject will have unique symptoms of central neural system damage. Rigidity of neck muscles, so stiff neck, localized or generalized spasms, convulsions, hypersalivation in men even, and hyperventilation in subject will have very fast and deep breath. And usually, again, virus will multiply in salivary glands and delivered in saliva. So in clinical presentations, usually we have two different types of rabies, or it is possible to differentiate two different types of rabies: furious rabies and dumb rabies. So furious rabies means hyperreactivity will appear, and in clinical presentations, hydrophobia will predominate in clinical presentations. Means that subject will be afraid of water. Any mention, any contact, any visual appearance of water will make subject very aggressive. If you will ask about the water, subject will become extremely aggressive, will try to shout on you, to fight with you. If you will open the tap and water will go, subject will hear that sound. Or you will just ask something or will talk with the subject about water, subject usually became extremely aggressive. And we have dumb rabies when different types of paralytic disorders will dominate in clinical presentations. So in any case, acute neurological period will be changed or replaced with the paralytic period when breathing became irregularly, and usually subject will not be able to move, to talk, and just fixed position in bed will be observed in those people. So after that period, oh sorry, after that period, coma will change paralytic stage, and after coma stage, subject will die, and it is always the only possible outcome of the disease. So if you need to confirm diagnosis, of course, in the perfect way, any subject who was bited by an animal, or if you have some animal suspicious to rabies, it's better to take that animal with you. Of course, it's easier to identify diseases in animal if it is already neurological stage and that dog or some other, it is easier to identify animal. Or if it is some domestic animal or any animal which is have an owner, then you will need to ask veterinary book to check for vaccination, vaccines given for the animal, and actually vaccination card should be present in any domestic dog to check if animal is immune or not. If animal is not immune, then some tests can be done in animals. If animal was vaccinated and schedule of vaccination is correct, then of course rabies is not possible. You have nothing to be afraid of. So if you need to confirm disease, we have several tests. Of course, it is check of serum and the presence of antibodies against rabies virus. If it is possible to take that animal, or if you see already some neurological stage in human, then saliva can be taken to identify virus here. And if it is a bite or some wound which is suspected to be contaminated with virus, then skin biopsies can be taken. So identification of virus is usually done by immunofluorescence with antibodies against rabies virus. As you can see on those pictures, it is a brain biopsy of animals ill with rabies. Those green dots, green spherical thing, it is accumulation of virus in brain tissue. And of course, you see that it is extremely damaged, and virus is identified in multiple cells. Those green accumulation, it is a places of viral replication. Of course, those animals were ill, and diagnosis is for sure. So we have unique cytopathic effect, which is actually was described more than a century ago by Dr. Adelchi Negri, and actually that phenomenon is still known as Negri bodies or Negri inclusion. It is a unique type of inclusion in affected cells. Usually it is nerve cells. They are identified in the cytoplasm, and they are stained by gene staining usually, or some other options are available, and they appear as red or kind of violet inclusions in the cytoplasm on affected cells. In the left picture, they are marked with an arrows, and again it is easy to identify them. It is kind of white or transparent vacuole and a reddish or a slight violet inclusion in it. So if that effect is identified, it is a place of viral replication. That cell is for sure infected with rabies virus. So again, that test is more difficult because it's not so easy to identify them. You will need to view multiple fields, but again, if immunofluorescence or other methods are not available, then biopsy of brain tissue can be studied for that unique inclusion known as a negative body. If you talk about outcomes, then as we said, any symptom of neurological disorder appeared in subject, it is always poor outcome, and it is always fatal outcome. So no cure for clinical disease is possible still in nowadays. And actually, I read a few articles where it is was saying that we saved people, but actually all those cases, they're limited only to life support, and those people were placed in artificial lung ventilation and feeding tubes or parenteral feeding, and they were kept alive for some years, and some of them even for a few decades. But it's not actually a man, it's not alive. It is just the body which is fixed to the bed, and those people, they cannot move, they cannot talk. Is it really alive? So in our country, the common practice is not to give artificial support for those people, because we still not have any treatment options, and always those people will just suffer for a few years and severe suffer. Of course, it will be a problem for relatives, but outcome is still death, because those people usually will have multiple complications with bacterial flora, pneumonia, severe damages of skin and underlying tissues, and of course, it's not possible to turn them back to normal life. So we're saying that outcome is always fatal for those people. So to prevent the disease, we have two types of vaccines. It is animal vaccine and human vaccines. Of course, the main measure is vaccination of animals to prevent transmission of disease to human. We have injectable vaccines for domestic animals. We have oral vaccines for wild animals, and they are given as some tablet or solution injected into the meat, and that meat is left in forest. Animal eat them, and with that meat they get oral dose of vaccines. But nowadays that practice is very limited and actually not used because of governmental problems. So human vaccines are known again for old time period. We have several types of vaccines. Actually, we had that classification in neural and non-neural vaccines, and nowadays it's not really actual. Usually we have vaccines obtained from cell cultures, and we have two indications for vaccination. It is vaccination for those people who are at risk to be bitten by animal or to have a contact with the virus. Usually it is veterinary doctors, forest keepers, dog trainees or dog hunters, and those people can be vaccinated, of course, before any contact with those animals. In that case, we have three main doses in 0, 7, and 13 day after the first vaccine, then revaccination in a year, and further revaccination every 3 years while the subject is in the risk to be bitten by animals. Immunity is not very long, and that's why scheduled vaccination of every citizen is not performed in any country, because it will be very expensive, and actually rate of rabies in our countries is very low. If some subject was bitten by animal, then we need to prevent post-exposure prophylaxis, to perform post-exposure prophylaxis. Of course, it is common practice of wound cleaning, surgical wound cleaning, removal of any foreign tissue. We have two types of immunoglobulin, human and equine, and of course, human is preferred, but it's not available in some cases. And we have vaccination for those people who were bitten. If in the case of bite, we need to give 7 doses as shown on that slide. So it can prevent disease before incubation period will be over.